If you've got darker skin, you need to consider very different types of treatments than people with lighter skin. People with darker skin, like mine, and darker are at higher risk of complications depending on the treatment. So it's really important for you to know what to do and what not to do. So I'm going to cover that in this video today. My name is Dr. Anthony Youn, and I'm known as America's holistic plastic surgeon. I help health-conscious men and women over 30 look and feel their best by teaching them a holistic approach to health and beauty. And today we're going to go over 7 do's and don'ts cosmetically if you have darker skin. If you've got darker skin, you know that it's rare for your skin to burn if you get a lot of sun. And this causes some people to think that maybe they don't need sunscreen or sunblock. Well, this is not true, because even though the melanin in your skin protects your skin from getting burned, it doesn't protect your skin from premature aging, from age spots, and from ultraviolet radiation that can cause skin cancer. So I always recommend to use a sunscreen, ideally with avobenzone, because this will help protect your skin from the damaging rays of the sun, whether you've got darker skin or lighter skin. Now, some people who've got lighter skin do really well with sunblocks containing zinc oxide and titanium dioxide. But if you've got darker skin, you've probably realized already that applying those to your skin can give your skin a bit of a whitish hue that looks quite unnatural. And that's why I recommend, if you can, stick with sunscreens containing avobenzone, which is in general very safe. Avoid oxybenzone-based sunscreens and octinoxate because they're known as hormone disruptors and they're bad for the coral reefs. Hydroquinone is a very popular skin lightener, and it is sold in doctors' offices all across the country. It is very powerful to reduce dark spots, and so it is used by lots and lots of doctors and prescribed. The problem with hydroquinone in people who have darker skin is the potential risk of ochronosis. Ochronosis is a fairly rare type of skin disorder where if you apply hydroquinone, you get dark patches that appear on your skin. This is something that happens in the darker skinned patients and people, but can happen to anybody who's got a good amount of melanin in their skin. So be very careful. If you've got darker skin, avoid hydroquinone. Certain types of skin tightening treatments are basically colorblind. They can be used in people who have lighter skin to darker skin with the same type of results. These in general treatments contain radiofrequency or ultrasound. Radiofrequency, there's a lot of different treatments. Pelave, Refirm are 2 names for radiofrequency treatments that are very safe in people who have darker skin. Ultherapy uses ultrasound to bypass the skin surface and heat the skin up from the inside to cause skin tightening. These are safe, colorblind treatments for people who have darker skin. The most popular laser treatments to rejuvenate the skin are ablative or fractional ablative. And these are lasers that create burns on the surface of the skin. But if you've got darker skin, you may realize that if you get some inflammation of your skin, let's say, for example, a pimple, the dark color that can result from that type of inflammation can stick around for many, many months. You don't see this in general in people who have lighter skin. Because of that, ablative laser treatments like ablative fractional treatments and CO2 type lasers can be very, very harmful for people who have darker skin. You can get this PIH, post-inflammatory hyperpigmentation, where you get a lot of dark spots on your skin, or you can get the opposite, where that laser can actually damage the melanin of your skin and cause your skin to have light patches or even a bit of a lighter hue to your skin. Once again, not so good. So if you've got darker skin, I would avoid ablative laser treatments and fractional ablative laser treatments. If you've got darker skin and you want to get rid of some wrinkles, if you want to fill in some lines or even plump up the cheeks, it's typically quite safe to use Botox and injectable fillers with your type of skin. Because the cannulas and the needles used with these devices are quite tiny, they don't usually leave a scar behind. And therefore they are appropriate and very helpful in people who have both lighter and darker skin. Many facial operations leave scars on the face. There is a very popular procedure right now, especially for young women, called the upper lip lift, where there is skin removed from the base of the nose to lift the upper lip. Not a good idea if you have darker skin, because you are at a higher risk of a darker and a thicker scar than somebody with lighter skin. There are other operations that you can do on the front of the face that can create scars that could be quite unsightly, especially if you have darker skin and once again are more prone to a darker scar, a thicker scar, and even a keloid. Some surgeries include a forehead lift, utilizing an anterior hairline incision. So there's an incision made literally in the forehead here. Not good, because if that scar turns dark, you'll be able to see it. There are other operations like a corner mouth lift, where you can get a scar in the corners of the mouth as well that could be visible in people with darker skin. So if you're considering any type of facial surgery and you've got darker skin, be very aware where those scars are going to be, because those scars may be more visible in you than in somebody who has lighter skin. Although having darker skin can predispose you to certain complications from certain types of facial treatments and cosmetic treatments, the good thing about having darker skin is that in general, it ages very, very well. It is very common that you hear people say, wow, people who are African American, people who are Asian, they have great skin as they get older. There are some reasons behind this. One big reason is that people typically with darker skin can have a bit thicker skin and a little more oily skin. It's like a natural moisturizer. And so be very glad that you've got darker skin, because in general it ages well, and hopefully you may need less of those types of cosmetic treatments than some people with lighter skin. Thank you for watching. If you've enjoyed this video, click subscribe right down here, and we'll see you on the next one.